Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and what a show we have for you. You won't believe it. I am accompanied by my three nieces. That's right, my three gorgeous, talented, smart, fantastic nieces. These are my sister's daughters, and I have operated on all three of them. So you're going to want to find out what we've done and what is going on. So what did I do? I did all three of their noses. In Persian culture, it's a rite of passage. It's like a bat mitzvah. And then on top of it, we're Jewish. So I'm accompanied by all three of them. They're all spectacular. We're going to have a dialogue. We're going to talk about all the ins and outs of rhinoplasty. So one by one, I'm going to introduce you guys. Let's start from eldest. All right, Tara. Tara, I'd love for you to introduce yourself, tell me how old you are, briefly tell me at what age you had your nose done.
Absolutely. Hi, I'm Tara. I'm the eldest. I'm 25 years old. And it's funny because I actually wasn't really thinking about doing it. So I'm the latest out of everyone. So I did it last year. I was 24, I think, or 23.
24.
24. Okay. Yeah. About a year ago. So, I had a little bit of a sports accident that kind of spurred me into thinking about it. So, I did it.
So you're 25 and you did it at 24. Okay. Yeah. Awesome. Then we go to the second eldest, Tessa.
Hi,
How you doing?
I'm Tessa. I'm 22, and I had a different experience. I knew I was going to do my nose the second I graduated from high school. It was something I wanted since I was probably in 7th grade. And I knew that when I graduated high school, before I went to college in that transition, so I was 18 years old, I did my nose, and it was still the best.
So you are currently 22, and you did your nose when you were 18.
Yes.
Awesome. And the third sister, the baby, Tiana.
Baby.
All
Hi.
right. How old are you, and when did you do your nose?
I'm Tiana. I'm 18, and I did my nose when I was 18.
All right. So you're the freshest, the newest out of the Rahban mold.
I just did my nose a few months ago, April of this year. Yeah.
Awesome. So. All right. So why this show is fascinating, other than that you guys are my nieces, is you have three girls who live in the same household, who are of similar culture and similar background, and you all did your noses at different times, and maybe not so much for different reasons, but had different experiences. So it's kind of a really interesting dialogue to have. So let's start with the person who did it first, because Tessa did her nose first. So the question I have for you is, why on earth would you operate on your nose? Because you understand that for us as Middle Easterners, it's like a no-brainer. It's like, your nose doesn't look good, fix it. It's like not even a thought process. But for many others, there's this whole new concept, love yourself, you should, women empowerment, this is horrible, you're doing this for societal pressures and all this other stuff, which, while it has some truth, I generally think it's nonsense. I mean, you put on makeup, you do all these other things. Why did you do your nose? And obviously you were the most vocal of the three sisters in terms of wanting it and so on and so forth. So tell me, what was the reason you did your nose?
Yeah, I think that growing up, there was something about my face specifically that just didn't feel like myself. Like, it took away from how I felt and kind of who I thought I was, in the way that my nose, I would say, was probably the biggest difference physically, and that my nose took up about this much of my face.
For those of you who are listening and not watching, what Tessa is describing, because it's important to know, is Tessa, of the three sisters, had probably the different nose in that it was very wide and sort of thicker and bigger, while her overall features are generally kind of small and petite. Go ahead.
Yes. So it just didn't, I know this may be hard to understand for some people. It just didn't match who I was. It didn't feel like felt like it didn't really blend in with the rest of my face, with the rest of my features. And, there's those typical things of when I'm a teenager and I'm growing up and I hate the way that I look in pictures and I'm covering my nose when I'm taking selfies because I don't want that to be shown. Absolutely, those things were there. But on a deeper level, I definitely felt like it took away from who I was becoming and who I felt I was. It was holding me back in finding my full confidence. Um, and I think that a lot of times also for our age, it's like, oh, you get one surgery and you're going to start wanting filler and you're going to start wanting this and that. And sometimes it's just a matter of this was something on my face that I didn't like and I fixed it and I feel better. And that's it. And it doesn't have to lead to
Okay.
other things. And, it was just, it made me feel more like myself.
So everyone is going to assume that, I'm the plastic surgeon uncle. You decided you want to have your nose done. You told me, and bam, there we had. But that's not true because you had requested your nose for some time. And on several occasions, I refused. Is that correct?
That is absolutely correct.
Right. Because you came to me, and I think that you in particular were in a kind of a vulnerable place in those years.
Mhm.
You were struggling with a lot of other young adult related issues
Right.
that you have obviously outgrown and moved on from. But at the time, you were very young, even though age was not really the issue, and you had a lot going on. And even
Right.
though I'm your uncle and I can perform it, I wasn't like, you want it done? No problem. From a physical standpoint, I felt that you were a great candidate because you were a beautiful young lady. And indeed, your nose was discongruent or not in harmony with your face, right?
Mhm.
So, but yet I didn't do it. And you had to sort of beg me over several occasions to do it. So, when I felt the time was right, we did it. And obviously, we'll get to how it impacted you, but that's the reason you did it. The second person to do it was a surprise, right? Of the three of you, the person we would have anticipated who would not have done it ever was Tara. Just because, not because her nose was spectacular, not because she was the prettiest, just because it wasn't something that was on her radar. She didn't seem to be, I think Tessa and Tiana would be a more quintessential aesthetically minded person who care about the way they look,
Definitely.
are more conscious of like, oh, my hair looks good and my lipstick or whatever. Whereas Tara was more of a brainiac-y, more of a social justice warrior, and wasn't so consumed with the way she looked per se. So when she decided to do it, I think we were all not shocked, but I think we were a little bit more surprised. So Tara, um, when you decided to do it, why did you decide to do it? Yeah, what was the reason?
Yeah. So I guess like you were saying, my nose never really bothered me. So I felt pretty confident in myself, I was also much more of a tomboy growing up, so it didn't bother me. I played a lot of sports and stuff like that. So it was never kind of top of mind for me. I always was like, oh, it would be nice maybe if, I felt I liked my nose a little bit more or anything like that, but it never was pushing me to kind of get the surgery and go through the process. Like I mentioned, I had a little bit of a sports injury that was unanticipated, and I was just gushing blood everywhere. My nose was super swollen, and I just kind of freaked out. And so I called Roddy, and I was like, I don't know what to do. I don't know what's going on. He told me I had to wait 6 to 9 months for it to heal, just given, we didn't know what's going on. That's how you
So
have
the
to.
sports injury was you got hit in the face with a surfboard, which is quite common.
Yeah.
Whether that be soccer ball or
Yeah.
Krav Maga or jiu-jitsu or in this instance surfboard. So go ahead.
Yeah. So, and I had been hit in the face with a soccer ball a million times too. So I'm sure there was other underlying issues there. But I guess after talking with Roddy about it, I waited patiently. And during that time that I was waiting, I thought about it, right? If I was a candidate, would it be something that I was interested in? How would that impact my life, et cetera? And I was working full time. I was working a lot of hours. So I needed recovery time. There's just a lot
But
of.
what was the reason? But what was the reason you did it? Because initially you told me, let me highlight this.
Yeah.
You got hit in the face with a surfboard. Naturally, your nose swelled up. Naturally, it looked a little crooked, which it does in everyone's nose. You get hit in the face, it's going to swell. It doesn't swell evenly.
Yeah.
It always looks crooked.
Yeah.
The swelling went away. And then you kind of were like using that as a little bit of an excuse because you'd be like, yeah, it's just not the same anymore. I'm like, no, it's the same. Your nose is not crooked. It's the same. And which is interesting because Tessa needed no excuse. She was unbashful about wanting to do her nose. She was like, sign me up. And you needed to convince yourself you needed the nose.
Yeah.
And so why I think this is so valuable is here are two individuals, arguably the same nurture, a different nature. So you got this thing, it heals. So what was the reason you did your nose?
Yeah, I mean, I think it just brought to light that maybe I didn't like it as much as I thought I did, and it was good timing for it. And I thought about it more and more, and I think, even though I'm not as upfront and focus on those things maybe as much as Tessa and Tiana, it was something that would make me happier and would make me feel more confident. And once I thought about it, it was kind of a no-brainer for me to do
Okay.
it.
So here are two perspectives, right? Because everyone assumes that, oh, the person who gets cosmetic surgery, oh my God, they're a plastic surgery junkie. No, here's the exact polar opposite of an individual who never in a million years would have done it, but internally knew that she wasn't ecstatic about her nose.
Yeah.
And at some juncture did it. So then we shift gears to the youngest, who now has two sisters who've done her nose. So the question is, did you do your nose out of peer pressure? Because like now you're not part of the clan. We will get to the fact that your mom had her nose done, which is my sister, and your grandmother had her nose done, which is my mom. So the question is, why did you do your nose? Were you peer pressure? Did you feel like you'd be missing out to all these women in your family?
Yeah. So, I mean, everyone, at least from the outside perspective, would be like, both her sister did it, her mom, her grandma, like kind of just everyone did it. She's just going to fall in line and do it too. Um, and I'm not going to lie, it definitely had an impact that everyone in my family had done it. Like, obviously, a person who has had so many people around them do it is going to be more convinced to do it than someone who has it, in my opinion.
Do you think the fact that people around you did it made you more convinced, or did you feel more comfortable? Because there's a
Comfortable.
big difference, right?
Comfortable is the word.
So there's this group of women, they're like, oh my God, your family members, oh, they pressured you because you're the only girl. Whereas I would suspect, because obviously I know from personal experience from watching you guys, it just didn't seem so odd. It was more acceptable.
Exactly. That's
Okay,
a much
fine.
better way to put it.
Go ahead.
Comfortable, not convinced. I was a lot more comfortable because I had seen so many people around me go through the experience. So it wasn't something that was foreign nature. I was more comfortable with it.
Okay.
And then when it came down to it and it was my turn or whatever, and I had turned 18 years old, it didn't seem like, oh, everyone else did it, I had to do it. I just had seen how positively it had impacted my sisters and like my mom and stuff like that. Like Tessa was a completely different person after she did her nose. Like I have seen how much it can change your life. And obviously, I was not ecstatic about my nose either. Like, I did not love it. And like you said, I kind of figured I was going to do it. So when my time came around, I was just really excited. I was like, finally, I get to have that change that's going to make me so much more comfortable in my skin and make me so much happier, just the way it has positively impacted everyone else around me. So yes, it was definitely more common for me to do it because everyone else had, but it wasn't because I felt like I had to. It was because I knew it would make a positive impact on me.
So that makes sense, right? So you have the first one who does it because she inherently knows within her soul, I need to do this. I hate my nose. You have the second one that does it because it sort of creeped up on her, and then eventually, because of her personality, came to light that I'm not really in love with my nose, and I don't have to be plastic surgery crazy or love aesthetics, but I can see the benefits. And the third one did it because she could see the light, right? I don't really have to navigate this. It's just so obvious. I see all of the pros. I see very little cons. I really don't like my nose. Let it be known that all three of you, from a candidacy standpoint, let's forget about your related. Let's forget about your backgrounds. Let's forget about that I'm your uncle. Let's just talk about your noses. Individually, all of you, your noses were good candidates. In other words, we didn't just do this because it's just, was it the thing to do or the pattern? If any one of you showed up individually in my office, I would easily have said, yeah, you guys are good candidates. What the hell does that mean? It means that your noses were a form or a shape that was less than ideal for your faces, and that when manipulated and changed, albeit subtly or dramatically, would make your face shine. So it's very important that that be understood. It just happens that you're all related, which is not surprising, right? Because you have the same genetics. So it's not surprising that your noses are all similarly not matching your face. And it's not surprising that your mom had it done because you got her real nose, right? You didn't get her done knows. You got the genetics, and we don't
We
even want to go
wish.
into,
Yeah.
we're not going to even go into your dad's nose. We're not going to even have that conversation.
Save the people from that conversation.
Ooh.
To me, and the reason why I'm so, I don't know, I'm obviously a huge plastic surgery advocate. And it's not because it's my livelihood. That just happens to be how I make a living. I'm a huge plastic surgery advocate because what I have experienced in patients and has been so glaringly obvious in my three nieces is the impact of plastic surgery is a ripple effect that you could never in a million years anticipate. In other words, you make a singular change, a one-to-one change, and it is exponential, the impact. I invest $10 and I get $35 million in return if I invested it in this portfolio. Like, what the hell could you invest in that pays you back at that degree? So we're going to take a quick break and then we're going to come back. And then I want to hear how it has impacted you each individually on a deep level, because the reality is that no one needs to explain to anyone what it is they do or why they do it. It's no one's business. You think plastic surgery is bad? Great. You think it's great? Great. You think it's shallow? Great. You think you should love yourself? It's none of your business. But for those individuals who are curious, because ultimately what we do in life should be predicated to making us happy, the question then becomes, what was the impact? So if you want to hear, hang tight. We're going to take a quick break. We'll be right back with the second half of Plastic Surgery Uncensored. Welcome back to the second half of Plastic Surgery Uncensored. All right, I know everyone's salivating to hear the second half. I am honored to have my three gorgeous, spectacular, smart, driven, and beautiful nieces on. All right, so the question that I want you guys to talk about is, we keep talking about it, but let's really put the emotions behind the discussion. How did your nose impact your life? So let's start with, again, in chronologic order of who did it when. So Tessa, you were a young girl. You, by all intents and purposes, didn't have a very good nose for your beautiful little features. You knew you wanted to do it. You did it. And tell me how it impacted your life.
Yeah. So something that you mentioned earlier is that I was going through a lot of changes in my own personal life with my mental health and just with discovering who I was. And I do appreciate that you said no the first few times I asked, because there was a lot of me that I had to figure out internally. And kind of when I did my nose, it was a part of that process of discovering who I was. And when you did it, when I was finally ready, I had overcome a lot of my obstacles. It felt like that finishing touch, to really being able to be who I was. And I was going to college, and I was going to be around completely new people. These people knew nothing about me. And for me, it felt like I could enter this new chapter of my life really finally with everything, all the tools and resources I needed to do that. So, for example, in high school, it was really hard for me to look people in the eye when I spoke to them, because I felt like they were looking at my nose.
What your guys are going to express is going to be echoed by every single patient, right? This is not unique to you. So patients will almost always tell me, prior to my surgery, I had a hard time getting eye contact because I felt that everybody was staring at my nose. So that is very common. So what you highlighted is very, very true. The other thing about it, I just highlighting some of the things you said, it is very common for young adults to do their noses often in transitional periods in their lives because they get a new beginning and they don't really have to explain per se to anybody anything about why, when, where, how.
Right.
Although, as Tiana will say, you can do it while you're there because you don't give a shit. You're doing what you want. But it is not uncommon for people to do it in transition. Continue on how it impacted you.
So, when I got to school freshman year, like from that first day, it almost was like this weight lifted off my shoulders, because I wasn't insecure about going out with my friends, and I wasn't insecure, about going out to the bars and meeting people. And I was able to focus on my personality and who I was and how I was presenting myself, I have so much to offer in terms of my personality, and I didn't have to be worrying about my looks and putting in that extra effort to like contour, the crap out of my nose. And I didn't have to focus on that. And I could focus on me as a person, introducing myself as a person to these new people and not worrying about covering that up because of a physical feature of mine.
So incredibly well said, which is interesting because people assume that plastic surgery in and of itself is the thing that you are excited about and the thing you want to show people. And what you've described is what I often say is actually the truth. Plastic surgery erases, removes, gets rid of the impediments that prevent you from being who you are.
Absolutely.
So what it does, and I say this all the time, is no one ever comes up to you and says, "What a stunning nose." They say, "What a pretty young lady you are."
Mhm.
And what it does is it deletes or removes the impediment and allows you to shine as bright as you are. It removes the filter. And so it isn't that now, as a result of your nose, you are catapulted because your nose is so amazing. It's now that my nose isn't so bad, I can just be. And the real thing about plastic surgery is being at peace. It doesn't matter.
Yes.
It's like this whole new concept of transgenderism. Like, I just don't feel comfortable. Well, what does that mean? I'm not. And then when I wear this dress or when I wear this, I feel comfortable. Okay, well, great. I mean, you're in your own skin. So that, I think, is a very well said statement, which is it allowed me to be the person that I am because it got out of the way. So let's shift gears because I think it's just different perspectives. So Tara, you've always led by your personality, right? Whereas, Tessa was going through a younger phase. You were 24. You're like this, hey, oh, Tara Niku. Oh, yeah, valedictorian. Oh, Tara, the brainiac. Oh, Tara. So that's why we're like, she doesn't give a shit about her nose. Like, what difference does it make? You don't need that to get out of the way. But interestingly enough, you did your nose. So the question is, how did it impact your life?
Yeah. And I would say it's funny because, as I listen to Tessa talk about this, it's just for her, she was like, I know it's going to change my life. I know it's going to change my life. And for me, like you've been saying, it wasn't top of mind. It wasn't something that I was waiting for and, hoping for. And I think I underestimated how much it was going to impact me. I was definitely nervous about it and, trying to figure out how I was going to feel. But I think what I ended up realizing was such a subtle change really changed my day-to-day interactions. It made me feel confident. It made me feel better when I put on makeup. It made me feel, just like you're saying, more comfortable in my own skin. And I think it was interesting for me just because I didn't really know how I was going to feel, and I was so happy afterwards. And I was excited about it for sure. But I think when I first saw it, I was like, I just feel so much better. And I didn't even realize that that was how I was going to feel. And I was emotional by how happy I was. And I think, like, for me also, I'm like, because I have a lot of dark features being Persian and, a lot of my friends don't, I just always felt like my nose was maybe sticking out, or when I wore makeup, it just wasn't fitting right, or things like that. And as soon as I kind of started living my life again, going to work, seeing friends, little things like that, it just I felt myself be more confident. And I think for me, I was never really like, oh my gosh, I look so good today and I'm, going out and doing all this. But I definitely felt myself kind of feeling more comfortable in my own skin and feeling that side of me come out a bit more, which I really
Yeah.
like.
So again, why are we doing the show? Because I have access to all these incredible young ladies that are all somewhat connected, yet have kind of different experiences. Tessa was certain that it was going to make her life better. And bam, what do you know, it was exactly. And Tara was like, I'm not really sure what's going to happen. And was shocked and surprised and pleasantly, happy that, oh my God, it's kind of like the person who thinks they have normal breathing. And then I operate on them. And then they're like, holy shit,
Yeah.
I can't believe how crappy my breathing was before. Because I breathe 10 times better than I did. And what I thought was normal was really not all that normal. So it's not that you weren't normal before and now you're normal, but you didn't realize in your instance, because of your personality, how much perhaps the way you saw yourself was somewhat subtly impacting your fullest potential. Now, remember, what we're trying to do is maximize your fullest potential. So I didn't make you a superstar. This just made you know and behave in more of a superstar way. So we're going to shift now to Tiana. Again, the third and unique perspective is now you've had these two sisters, totally polar opposite sisters. They couldn't be more opposite, both of them going through experiences, both of them coming out, and you did it. And the question is, how has it impacted your life? What has it done for you? And it's only been what, 4 months?
4 months.
3 months? So you get to say the early perspective. They can give you, oh, it's been 2 years. In Tessa's case, 4 years, whatever it is.
Well, I like, not even just saying this because like I need to say this. Like, this is one of the best things I've ever done in my entire life. Like, I can't even begin to explain the amount that it's changed my life and just made me so much more comfortable in my skin. So like Tessa, she did it in a transitional period right before she went to college. I'm also doing it right before I went to college, but I did it halfway through my senior year. So
you were still in school,
I was
right?
still in school,
So
yeah.
Tessa did it where theoretically she could duck and get out.
Yeah.
Doesn't have to really answer to anybody, hey, why'd you do it, or whatever. She could start a whole new life. You did it during senior year.
Yeah.
All eyes were on you. You were valedictorian. Everybody was looking at you. So there was definitely going to be some heat. So go ahead.
I was definitely nervous about doing my nose in such like a prominent time when like senior year, all the senior activities. I was also senior class president. So like I was in charge of everything. Like just like that was going to be a big change in a very prominent time in my life when a lot of things were happening. But at the end of the day, I wasn't doing this because of what other people were going to think. I was doing this for myself. So I was like, you know what? Screw these people. If people are going to judge me, good for them. If people are going to love it, good for them. I'm doing this because I want to do it. And I did it. And I came back. And honestly, I was overwhelmed by the positive reinforcement. Like, people were very, very kind and just accepted my nose as much as I did. But one thing that like really, really, really resonated with me and I think just like made me so confident in my decision was people would look at me and be like, you're still you. You still look exactly like you, but you just look a better version of yourself. Like I didn't feel like a different person. People didn't look at me like, oh my God, what happened to you? They looked at me and they're like, wow, it's such a subtle change, but you look beautiful. Like this was
the objective with plastic surgery, when done correctly, is to make you a shinier version
exactly
of yourself.
Yeah.
All we're doing is polishing the penny.
Yep.
Right? We're just shining it. We're not altering it. We're not redesigning it. We're just making it a cleaner version of you.
Yeah.
So, so you went back and how did it impact? Like, so you're sitting in there and you're talking to someone. How does it actually impact you?
Yeah. So now when I'm just like, honestly, this is my favorite example to give. My prom, which Rady was wonderful and escorted me to. I think that's what I
substitute parent.
Substitute parent, step-in parent. I just like when I was taking my pictures and like before I used to take pictures, I would like do my best to cover my nose, just like cover my face. I was taking my pictures and I was like, I was just like so confident in myself and like just like when I had my dress on and I had my makeup on and my hair done, like my nose was not ruining everything. Like it wasn't taking it down. I just felt like I embraced everything and I felt so beautiful. I talked to people and like Tessa said, like I wasn't insecure because my nose was some fat thing on my face. Like I look at people and I'm talking to them, I'm like my face, it's like put together now. Like my nose is good. And like I just like was so confident in myself. I felt confident with other people. I felt just like everything else felt better because of my nose. My hair could look ugly, but all of a sudden I think it looks better because my nose looks good. Like it just like made everything better for myself.
So what you guys have said, I like to do recaps. First of all, what it does is it deletes something that is making you insecure so you can be secure. Number two, what it does is it allows you to be present. So much of life we're not present. We're conscious of what people are saying, thinking, do I stand right? Did I snort? Are they looking at me? Am I fat? Is my hair bad? This is all human beings. This isn't young girls. This isn't men. This is everybody. It allows you to be present and absorb the process. It allows you to be your best version because nothing is tied to your leg and pulling you down. And obviously, all of this is predicated on someone having surgery, it turning out well, and it enhancing them. We could have 3 people here who are hopefully not my patients, but have had to have revision rhinoplasty, and we could have the exact same show and talk about how terrible everything was, right? Just think about that. We could have 3 young girls. I did my nose. It was horrible. It ruined my life. I couldn't go out. People were staring at me. They couldn't recognize me. So let's not take for granted the fact that you all had, and I'm not patting myself on the back. I'm saying we're having a conversation about good outcome plastic surgery.
Yeah.
I thought it's interesting because you're my nieces, but I don't want to just be like, oh yeah, all plastic surgery is great. It makes everyone confident. No, it can destroy your life. You could literally be ruined, never leave your house again. But we're saying when it is good, it has all of this power. So all things powerful are powerful in two directions. The atomic energy can be a bomb or it can light up a city. A knife can save your life or it can kill someone. It's always that way, right? So it's always the case. So now I'm going to shift gears to you guys. I don't want to say you had it easy, but you had it easy.
I think we had it easy.
Right? You guys.
Other experiences I've seen.
No, the reason you had it easy is you had me. So when you guys go to do this, you have to seek out an individual who will execute what it is that you're trying to execute. So what was it that you guys were worried about? Because it makes it sound like, oh, my uncle's a plastic surgeon, so I just signed up then. I did my nose. Like, okay, great. This is a useless podcast. I don't have an uncle who's a plastic surgeon. Like, what the hell do I do? So everyone, happy for you guys. Not. I'm talking, what about if I'm in Idaho and I want to have my nose done? So let's go one by one and talk to me about what it is that you were worried about. What are you scared about? Tessa, number one.
So I think that even if Rady wasn't a plastic surgeon, I would have seeked out a plastic surgeon to do my nose. So
For sure.
I would have gone through that process. And so I was looking for, I was looking for things that any other person would have wanted. It wasn't like, oh, I'm just going to go because I'm just doing it because Rady's my uncle. I'm doing it because I want to. And I was lucky that I had this opportunity. I think what made me worried, Rady's work also speaks for itself. You could say, oh, my uncle's a plastic surgeon. That's great. But like, you have patients and you see the transformations and you do good work. It's more than you being my uncle. So I wasn't really necessarily worried about that outcome of how I was going to look. Honestly, I felt like my nose was so bad that anything would have been better. It could have been botched, but I still would have been more confident. And so I wasn't really worried about the work. I was more worried about you being nervous and that maybe affecting it in some sort of way, or
we're going to get to that because everyone else who's listening is just dying to ask me, how did you operate on your knee? So
yeah,
that'll be the end of it. But but you had told me
we see each other every week. Also, I want to mention it's not like we don't see each other. We see each other. So Rady was going to have to look at our noses every single week.
We're gonna get into that at a later point. But you had mentioned to me that obviously this isn't your first nose job, so you weren't stupid and never seen it. This is first nose job, meaning you've seen other friends and so what were you worried about based on
I see.
Like, what were you, oh my God, what if I don't know, what if my nose tip dies? What if I'm in horrific pain? What if I die on the table? Everyone's worried. What were you worried about?
Oh, I have a lot to say about this topic. A lot of people that I have seen have gotten their nose done were in excruciating pain, bruising all over their face, dark bruises that never went away, purple, blue, having to take their pain meds multiple times a day. I mean, just an awful experience, out of commission for weeks. I did not have a single bruise on my face. I didn't bruise once. And I don't bruise very easily, but I don't think me, Tara, or Tiana did. We didn't bruise.
Yeah.
I didn't feel any pain. I did not take one of my pain meds, not one. I didn't use most of the medications that were prescribed. I know they're prescribed as just in case. The only thing that threw me out of loop was the anesthesia. It took me a while to get back, walking normally. Other than that, I was awake. I was live. I felt good.
So you weren't worried that your nose would botched. You were worried that your recovery would be horrific like everybody else that you saw.
Yes.
Tara, what were you worried about? Because you are a little bit more of a pensive person.
Yeah.
Tessa was like, I don't even care if he cuts my nostrils off. It's going to look better. So you didn't have that mindset, and you tend to be a worrywart, and you tend to look at the glass half empty. So tell me what you were worried.
I'm definitely that was I wouldn't say that. I'm pretty positive.
No. Listen, what I meant by that is that, by the way, that's how I see the world. I see it half empty, meaning I look for the areas I'm critical, I'm particular. I find I don't just walk around the world as, full of roses and rose petals. So go ahead and tell me what you're worried about.
Yeah, so I echo Tessa's point. The recovery was a huge concern. I was taking a few days off work. It was a whole thing, and good. I didn't have any bruising.
But what were you worried about? What were you worried about?
I was so worried about my face. And it wasn't I know
What
Rady
aspect?
amazing. No, I just thought people weren't gonna be able to recognize me.
Okay,
My
that's a
nose was
very
so
common
different.
one, right?
Oh,
I
for
hear
sure.
that all day long. What are you worried about? I am not going to recognize my face.
Yep.
I'm going to be unrecognizable to my friends and family. I'm going to lose my ethnic identity.
Like an identity crisis.
Yeah.
Like, I'm not going to look Middle Eastern. I'm going to look like some Irish woman. Like, people always worry about that. Remember,
Yeah,
you're
for sure.
rearranging your face. Tessa, did you feel like you lost your identity?
Absolutely not.
Do you felt like people didn't recognize you?
Absolutely not.
Tara, Tara, what about you?
I have a point on that because most people did not know, couldn't tell that I did my nose. They just said, "Wow, you look really good."
Agreed.
They didn't say, and me being myself, I wasn't vocal about it. I didn't talk about it. It was very under wraps. It was during COVID, and then I would see my friends a few months later, like, "Wow, you just look so good today. Like, did you do something to your hair?" They couldn't even tell because it matched my face so well, and it was so perfectly fit.
So you were worried because you said that you were, so what you said, it was very common, which is, I'm just worried that I'm not going to recognize myself. Tiana, what were you worried about? Again, so you always have the unusual perspective because you have these now 3-year mom, but you didn't see her. You have these unique perspectives. So that's why the third child is always I don't want to say the most courageous, but the one that, because the paths have been blazed in some ways. So what were you worried about?
Yeah. I mean, I would like to say that I had very similar concerns to my sisters. I mean, one that I had that, like, everyone's gonna have is that I just hate surgery. Like, I was just, like, so terrified to, like, undergo that entire experience.
What aspect? Let's highlight that. What aspect of surgery were you again, because I'm trying to make this a useful dialogue for those people who are worried. You guys are just regular people. You had nose jobs. So what you're worried about is what they're worried about. So what were you worried about surgery? You thought it's gonna be painful, you're gonna die. What were you worried about?
I thought it was gonna be painful. I'm pathetic. I literally look at the needle and want to throw up. I was like, oh my God, they're gonna, like, stick stuff in me and, like, I'm gonna die.
So you were worried about the poking of needles. How
Yeah.
many needles did they poke you with?
One.
Was that horrible?
One in 0.5 seconds,
Right.
and then I was out like a light.
So many people are afraid of needles.
Yeah.
So they don't want to have surgery because unbeknownst to them, they think you're going to get poked like a pincushion.
Mhm.
How many pokes does it take to do surgery? One. There's
one.
one IV. It's one poke. It's over. There are no other pokes. You feel nothing. So
I
clearly
would add, the part
Yeah.
that you're awake for while you're actually in the surgery center is a total of like 30 minutes.
Yeah.
Like,
It's-
the majority of you being in the surgery center, you're not.
Yeah, you don't even remember any of it.
The
But
process is extremely quick.
yeah, but so that concern of yours is echoed by a lot of people. So I'm going to do 2 more things, and then we're going to wrap it up. But the last thing we're going to do is I'm going to talk about my experience. But I want you guys to give one solid, golden recommendation as young adults who did their noses to other young adults who think, may want, may be considering, are against doing their noses. So, Tessa, one golden recommendation.
If there is a part of you that feels that you are hiding yourself in some sort of way because of a physical aspect of you that, luckily, because of the day and age that we're in, it can be fixed, do that for yourself. Do that for your confidence. Do it for your personality. Do it for your potential. Physical change seems very intimidating, but what it creates for who you are as a person is, like you said, it's an investment in yourself, and becoming who you are fully and who you are meant to be is absolutely worth, you know, being nervous or, worrying about other people are gonna think. It's 10 years down the line, I don't wake up and think every morning, "Oh, I had a nose job." It's become a part of my life, and it's just, it's a big
Yeah, you
deal in the
forget about it. I mean,
moment.
there are instances where people are like, "Have you had surgery?" Like, "No." "Oh, shit, that's right. I did my nose 20
Yeah,
years ago." Like, nobody
exactly.
remembers.
That just happened to me at the doctor's office.
It
Yeah.
seems like a
And
big
yours was like
deal,
4 months ago, and you've already forgotten about it.
No,
but it's
literally.
a small, especially the experience with Dr. Rahban, it is a small, you know, price or whatever to pay to to really feel like who you're meant to be.
So, I think that's a very good one, and so I'm gonna recap it for you. If there is something that can be corrected
Exactly.
that is impeding you, preventing you, dragging you down, if you can, that means you can afford it, you're capable, you're in a position to, you find an individual who you trust. It's highly suggested you do it because when that thing that's correctable is corrected, you can anticipate how free you will be. So
Mhm.
that's what Tessa's recommendation is, and it's very true. The caveat to that is that you must make sure it's done correctly. Again, we could have this exact same podcast and it would be the exact same opposite. Three young girls that did their noses in which it's ruined their lives. So we're talking about when it's done correctly, it has incredible power. Tara, what one golden advice do you give to somebody?
Yeah, and I would say this for coming from my perspective, there's such a stigma around plastic surgery, and I think it's a mindset, like you're saying, you do one and it becomes, you're doing a million and you change yourself completely and all that. And I would say if it's done properly and if it's with someone you trust and it's the right person and you've thought about it, it really can change your life for the better. And so don't look at what you see in the media. Don't look at, a lot of fake
Mhm.
things that you see out there. It's about you and your body. And if you're doing the right thing for yourself and you know your doctor, you know the results, and it's supposed to help you feel better about yourself and feel natural, don't feel bad about it. Don't question your thoughts about it. It's about you and your body and doing the right thing.
So
So,
that's excellent.
yeah.
So what Tara is saying is that we're actually in a funny time because now if you're doing plastic surgery, there are people that are very vocal about it, but it's sort of the love yourself generation, the shame on you generation, the women's empowerment generation. Not that women are the only one that do plastic surgery, but certainly there is this concept that you altered your nose for society. This is a male dominated world. You're an object, right? There's a
They
lot
think
of
we
that.
woke up and thought we were Kim Kardashian. They think you
Yeah,
wake
right.
up from surgery and you're like,
Right.
"Now I'm Kim Kardashian
Yeah.
and I'm gonna
Yeah. So there's a
change
lot
everything
of
about myself."
there is a lot of, as much as there's positive, there's a lot of negative connotations, as Tara had said, a lot of stigma. I have patients who come in reluctantly because they're wearing Birkenstocks and are vegans, and they feel like if they do plastic surgery, somehow it's like they've gone over the dark side. You can drive a gas guzzling car and still, love organic food. You don't it doesn't define you,
Yeah.
but people have an issue with it, and there are individuals who can't get over or have a hard time. So excellent point. All right, Gianna, what is your golden recommendation or thought process or
100,
suggestion?
like 150%. My one piece of recommendation that will determine everything for you: know your surgeon and make sure it's the right person for you. Because this experience that my sisters and I were lucky enough to have would not have been possible if we didn't have an incredible surgeon like Roddy. The no pain, the no bruising, the incredible recovery, the way our faces looked, the pain, like it was perfect, not because all surgery is like that, but because we were in the hands of someone who knew what they were doing. So if you're going to go through this process, which can be extremely difficult, make sure you're doing it with someone that's going to make it the best it can be for you, because that will determine everything. So
And that's very true. And it's not to suggest that I'm it and there's no one. No, there are
exactly.
many,
Right.
many talented, capable, kind, conscientious surgeons. They are the minority, but they're by being the minority, since we live in this country, there's still a lot of them.
Yeah.
And you just have to make sure that the relationship you have is an individual who can. So the take home is, if you get a great result, these are the things that can go on, which is the happiness, the joy, the whatever. So you got to make sure you get a great result for this whole podcast to have any meaning.
Exactly.
So I'm going to wrap it up with just a little, I've had hundreds and hundreds of conversations about this. You guys have had millions of people ask you. So the question is, how on earth can you operate on family members? Isn't that illegal? Isn't that a bad idea? How did you deal with it? Like, what if something went wrong? What would you do with yourself? It's a very fascinating concept, right? I didn't operate on one of you. I operated on three of you. And by the way, there are no more sisters, so I'm done with this family.
Until our children.
Yeah, I'm going to have a tremor by then. So there are three things that I want to highlight in regards, just because I think it's interesting and hopefully it'll be fascinating. Number one, the question was, were you stressed? And the answer is, hell yeah. Of course I was stressed. No, I'm always stressed. You heard me? I am always stressed.
I got that gene from you.
True.
I got that gene from you, 100%.
So I'm always stressed when I operate because I give a shit.
Yeah.
I'm stressed when I operate because I give a shit. If it doesn't turn out well, not my nieces, everyone, I will be really, really bummed out. So when you care about anything, you're stressed about it because you want it to go well. So the sign of a surgeon who is not stressed is one who is arrogant and confident and assumes that nothing can go wrong. Any surgeon who doesn't stress about surgery, in my humble opinion, will have an issue at some point. Now, the fact that they're my nieces makes it more stressful. Obviously, I have a lot riding on it. They're my nieces. They're my family members. They're people that I love. I don't love my patients. I care about them, but I love them. And so I was naturally very stressed. Were you less stressed for the third one? No, of course not. I wasn't less stressed. Is she less important to me? Is her shitty outcome less important than the first one? No, I was stressed at all cases. They're all equally valuable people in my life, and they all could equally have had a bad outcome. So did I do any more work for them? No, I treated them exactly the same way I treated everyone else. Mm-hmm. I wasn't in surgery for 9.5 hours because it's my niece. The same amount of time, but of course the stakes were higher. The next question is, well, what happens when you see them? Well, when I see them, I'm stressed because if their noses don't look good, it will bother me. I don't see my patients on a weekly basis. I don't have to see them more than a few times. I just have to make sure they're happy. Now, listen carefully. This is a two-way street. What is the number one goal when you do surgery as a surgeon? For your patients to be happy. All three of these young ladies are happy, period. Therefore, the surgery was successful. But because I am a person and because I am particular and because I see them every week, because that's the way our family is, if their noses were in some way, shape, or form not good in my eyes, despite the fact that they were happy, it would bother me. And that's the cross I must carry. That's my burden. And hence why I was initially reluctant to do it, was not even so much that I was worried that they would be unhappy, that I would be unhappy, that I would have to see them on a weekly basis. They're oblivious. They're living their best lives. They're all happy. They're married. They're superstars. But I look at them and go, God damn it. That thing on the right side's a little fuller than the, God, I fucked this one up.
In other words, we took off 10 years of Roddy's life.
Correct. But then the question is, why did you do it? And the final answer is, because I trust no one else.
Yeah.
I did their noses
Mm-hmm.
because, as Tessa said, she would have had her nose done. And while I would hate myself if her outcome wasn't as good as I'd like, I would kill myself if my niece went to some piece of shit surgeon who didn't give a shit about her and she had a bad outcome, I would then really not forgive myself. Because at the end of the day, I allowed her to go somewhere else. And I will never allow my family members to be taken care of by anyone else other than me, because no one will care about them like I do. So yes, I took it upon myself. It is the burden that I had. It is an honor, but a burden. And I am just grateful that they turned out as well as they did. And never for a moment did I take it for granted that, oh, they're going to be perfect, because that's just not the way this works.
Even though it is perfect.
Well, perfect, as everyone knows, is a word I never use, but they are what needed to be done for you guys to blossom.
And they're all different. Each of it, it's not like the same nose on all of us. It's like each one fits the way we are meant to look.
And the fact of the matter is, now that I have accomplished this as a personal, for my own personal professional growth, I feel honored that I was able to do this, because this is a major accomplishment in my life, to operate on my family members, to create something that I feel I'm proud of. And most importantly, to see that all of my talents, all of my hard work, all of my training allowed for the betterment of my own family members. Then what else would I do this for? I help people all day long. What's the point if I can't help my own family? So, thank God it all worked out. And thank God these young ladies have taken what little I gave them and made it into a $35 million investment. Because I can assure you that it isn't the nose that makes them spectacular, but the reality is that they shine from within. And that's just the beauty of plastic surgery. And I think the three of these young ladies can highlight some of the beauties of what we can accomplish. So I don't know. I thought that's a pretty damn cool show, right? I want to see some other plastic surgeon pull up three of their nieces and be like, pow, there you have it.
Amazing.
Okay. So ladies, thank you very much. I appreciate you guys being on, being candid, being spectacular, and hopefully people will, learn something, or at the very least find it entertaining. Okay. I love you much.
Love you. Thank you for having us.
Of course. And as always, if you like our show, please write something nice. If you don't like our show, don't write anything. And share this with friends, and download it and subscribe. Until next week, I'm your host, Dr. Rady Rahban. We'll see you next time on Plastic Surgery Uncensored.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode, or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.